There have been tremendous advancements in the techniques and technology of arthroscopic rotator cuff repair over the last 5 to 10 years. This has allowed us to fix tears that have previously not been able to be fixed. What involves a surgery to repair a rotator cuff is an incision about as wide as a thumbnail. The camera's inserted, and the tendon that has pulled away from the ball of the shoulder is identified and sewn back to the ball of the shoulder. This is typically done as an outpatient procedure, meaning the patient goes home that same day. However, the repair is quite fragile, so patients need to protect the shoulder for up to 2 months in a sling. Physical therapy is an essential component of a good outcome.